What is a coronavirus? What should I do to protect the virus? Coronavirus was known as a self-contained virus that caused mild respiratory infections such as flu in the 1960s, causing a major epidemic in China in 2002. In this epidemic, which spread to approximately 30 countries, many patients, especially healthcare professionals, were lost from pneumonia. This world-threatening disease caused by a new coronavirus species was called the Acute Severe Respiratory Failure Syndrome, SARS. In 2003, the outbreak was completely under control, but in 2012 the coronavirus appeared on the scene again. This time, a new coronavirus was detected in a patient lost in Saudi Arabia with pneumonia and kidney failure. Today, our world is threatened by a new coronavirus infection. The virus, which was named Wuhan Coronavirus because it first appeared in the city of Wuhan in China, is spreading by causing many people to become pneumonia, kidney failure, monitoring in intensive care and even death. What are the symptoms of coronavirus? The disease starts like a seasonal flu after the incubation period of 2 to 14 days. Signs of upper respiratory tract infection such as fever, headache, tears, sore throat, runny nose, cough appear. Shortness of breath accompanying high fever and cough should be stimulating. Some patients may have complaints such as nausea, vomiting, diarrhea and abdominal pain. What are the ways to protect against coronavirus? Healthy people are required to close the respiratory tract with a mask when they go outdoors. It is much more important for people with cough, sneezing and fever, even if they are allergic, to use masks when entering the public areas. Wearing a mask with a large number of people in confined spaces may be meaningful in terms of encountering a potential patient. Since the importance of contamination from surfaces is more understood, it is very important for everyone who goes out of their home to take care not to touch their face, eyes and mouth after touching the surfaces in common areas. It is protective that anyone who spends time outside often wash their hands, disinfect with water and alcohol, the most easily found 60% cologne, in case of failure to reach the sink, and wash their hands more when they encounter sick people. Making a throat gargle with warm water and consuming plenty of warm liquid may prevent the virus from settling. Good nutrition, being in the open air, ventilation of closed areas, exercising, paying attention to sleep patterns affect the increase in general health and decrease in the placement of the virus. It is safer to use stairs instead of elevators as much as possible since it increases the presence in the narrow space. When the symptoms begin, it is very important to wear a mask when going to the health institution.